evening. 7 o'clock already. Good evening. Hi, thank you for joining. Good evening, good evening. Good evening, everyone. How are we doing today? I hope you've had a good day. Put an emoji in the chat to tell me how your day went. I hope you had a good day. I hope you had a good day. Anyway, quickly, today we're talking about fibroids, perimenopause, and mental health, and the overlooked struggle. And for someone who's gone through all three, honestly, it's a conversation that we need to have, and we need to continually have so that we can help women. But before I bring in my guest today, I've got Dr. Moji Adegbite. She's a general practitioner. I've got Sarah Lane. She's a therapist, soft tissue lymphatic drainage therapist, and I've got Abby Adefison. She is a warrior, a fiber warrior. She's a wow. When I heard her story, honestly, I was like, okay, But and we need to share the stories. We need to speak up, honestly. And anyway, today you'll hear more. But before I bring in my ladies today, I wanted to share a scripture. The word that I wanted to bring today is from Proverbs 9:6, and it says, leave foolish ways behind so you may live. Learn to understand what is right so that you can do it. And people, let's be wise. Honestly, we need to learn to understand, to do what is right for us. And that's how we can live life well and be intentional in the things that we engage in, that we surround ourselves with today. So today, I'm going to try and find my guests and bring them in. And today we're having conversation around fibroids, perimenopause, and mental health. And trust me, it's something that I'm going to look for my ladies. But whilst we're here, this is the Feminine Health and Fibroid Support Network. Our mission is to educate, to raise awareness, to support women on their journey to wellness, and honestly advocate for women's health and well-being. Thank you. I'm going to find my ladies and bring them in so we can begin this conversation. And bear with. I have seen one person. Oh, okay. I think I've seen everyone. Bear with me. I'm just going to bring the ladies in today. Hi, Sarah.
Hey, how you doing?
I'm good, thank you. All right, I've got Dr. Moji. Abby, I know I've seen you. Either okay, you know what? I've sent you an invite, Abby. You can either accept the invite or you can send me one. How's your day? Hey, there you go, Abby. Hi.
Hey,
How's it?
hi,
Hi.
hi,
Oh,
hi.
welcome. Thank you so much, ladies, for joining me. I'm waiting for the doctor. I've seen her on. Okay, I'm accepting her. Thank you, ladies. I hope you've had a good day.
Yeah, busy one, but productive.
Awesome. What about you, Abby?
It's been a hectic day,
I
but
can
I'm here.
imagine.
I'm glad I'm here. I made it just
Oh,
in time.
awesome. Thank you. Thank you for coming. It's amazing. I'm just trying to get the doctor to come. She's unable to join. Why not? I'm accepting her. Dr. Moji, please maybe come out and then come back in to try. You sent me a request of accepted it, but I can't seem to find you anywhere else. I've sent you another invite. See if you can accept that, or you just send me one. Okay. While we're waiting for Dr. Moji, are we good?
Yay.
All right. Sorry about this. Okay. Whilst we're waiting for Dr. Moji, I wanted us to introduce ourselves. If you go first, Sarah, if that's okay.
Okay. Hi everyone, I am Sarah Lane. I am a soft tissue therapist and a lymphatic drainage specialist, and also a fibroids thriving, not surviving anymore, thriving.
I like that. Thriving.
Yeah.
Thank you. Thank you. Thank you for coming to this conversation today. Abby, if you go next, please.
Yes, hi. Thanks for having me. My name is Abby. I'm a mom of two boys. I have the history of fibroids, multiple fibroids, all the different fibroids. Had fertility issues, had multiple miscarriages, and yes, the whole
Yeah.
works. And
So
but now living the life in full.
I like that. Living the life in full. Living the life in full. I
Of
like that. Well,
fibroids.
welcome, ladies. Welcome. Thank you for joining us. I really want Dr. Moji to start us with this conversation as well, because I was going to ask her some of the first few questions. But let's carry on. Sarah, if you tell me why do you think this conversation must be hard? What first of all, what drew you to women's health advocacy? And I know you shared a bit the other time, but why do you think this conversation like this must be had? And often, especially because a lot of women are silently suffering.
Yeah, I think this conversation is important because the more we talk about it, it becomes the norm.
Thank you.
And also the more we hear other people's stories, we don't feel in isolation, and the more we feel we're not alone, that it takes a village really, for us, for everybody really, for us in order to function, that we realize having that safe space of where you can talk about things where people are not looking at you like, oh, what's that? Trying to explain, but it's like we're speaking the same language,
Amazing.
Yeah, so I think that these kind of conversations are really important.
Amazing. Thank you. Thank you very much. And needless to say, honestly, we need to find a community. We need to find a group of people who is a safe space where we can hear other people's journey and not feel left alone and not feel isolated on this journey, because a community is a big thing. It's a big thing, and it's one thing that I didn't have when I was going through, and it's something that I am trying to bring to women to say, look, you can find a group of women who together you can walk this journey, holding each other up, helping each other, signposting, and learning from each other, so that you can thrive. Abby, what's your thoughts?
I think I definitely identify with what both of you have said, and it's really about making sure that people are not suffering in isolation. And I think that historically, and I know very much so now, it's still very much people suffering alone, not knowing where to go to, not knowing who to talk to, actually feeling a bit shameful because they're suffering. And actually, it's about finding the safe community, that safe space where you can share and learn and glean from others and understand the different experiences that people have had, and learn from that to help you and to help inform the type of treatment that you decide to go with in the future.
Absolutely, and that's so right. That's so right. And it just exposes you to a lot of information and education. And then because every woman is unique in their own story, in their own journey, but honestly, that's how you start to find what's your bit and what's going to work for you. And unfortunately, some of it's going to be a trial and error, or honestly, because I've had that where it was just a bit of try this, try that, and if that is causing that, okay, let's eliminate that and all of that. But the truth is, eventually you will get to a place where, okay, this is working for me, and and you start to thrive. Amazing, amazing. Thank you, ladies. Thank you so much. So my first question was going to be for Dr. Moji, but she's having challenges joining. I don't
Yes,
know
I
why.
think she's just sent a message to say she's still trying to send. She sent a video request to join, so I don't know if you want to check.
I've accepted it. It's here, and I accepted it, and I don't know why she's not able to join. I've sent an invite as well to her.
How many people can join at a time?
4.
Oh, okay. Mm.
Anyway, so let's carry on. So, Sarah, my first question is going to be, so this is how we're going to do it. So we're going to have it in segments. The first segment is going to be about fibroids, and then ask you some questions, and then we have conversation. Those next one going to be about perimenopause. We I ask some questions and we talk around it, and then the third one, of course, mental health, and then at the end we pull it all together. And being someone who's gone through all three, you know, I'm interested in hearing your views on some of the things, and if you've experienced it as well, let's hear how you've had to deal with it. And so, Sarah, to you first. So, I was going to ask Dr. Moji about treatment options, honestly, for women, especially now, because options have changed so much from the time that I was going through. Because then it was either you had mammectomy or you had well, it's hysterectomy. Even the ones that doesn't deserve hysterectomy, they throw it at you, and you're thinking,
Yeah.
really, you know. And then what towards the latter end, then I was offered uterine fibroid, and that was even right for me. But I was offered it anyway, and I was going to go with it until the last minute. But yeah, so but I wanted to ask about your journey with fibroids, and how what you do now has helped you, if it has in any way.
Oh, wow. Wow, that's like, I guess if we think about a chapter, that's the biggest chapter in my life, really. Because if it wasn't for the fibroids, I wouldn't be doing what I'm doing.
Right.
I came into this because I could not find anybody to help me, and at that time I wasn't aware that the issue was fibroids. And that's after seeing chiropractors, massage therapists. I mean, like, I saw everybody that you can think of, and nobody was able to say, since Black women generally have fibroids, let's check it. But then reflecting now, but maybe there is part of me that should have taken responsibility, because when I had my son, they did tell me that I had fibroids,
Okay.
but I didn't think anything of it. Like, this is what's affecting me. So what would happen is, randomly, I would just have this pain out of nowhere. I would go into A&E. They would give me medication. Within 2 days, I'm back to normal, and it was just coming randomly. And then about 6 years ago, the pain was so severe. I was driving. I literally had to stop my car and get my dad to come and pick me up, because the pain was so severe. So it was literally someone had a knife and they were stabbing me in my private parts.
Wow.
It was that bad.
Wow.
So going to A&E, explaining the situation, they're like, oh, well, it's the weekend. There's nothing we can do for you. You need to go back to your GP and get a referral for you to be able to have a scan. So imagine, with all that pain, cutting the long story short, I got worse and worse. So I came from being fit and, exercising like 7 days a week to
Dr.
not
Moji,
being.
we can see your battle.
There
Okay,
she
there you
is.
are.
You know me, I have my tech.
Yes,
It's
that's
always
why
a
we know.
struggle.
Thank you. Welcome. Sorry, Sarah.
Sorry.
Carry on.
um so I went from not being able to walk for 10 minutes without being in pain. I used to take one step at a time to be able to go upstairs. My life changed where I got depressed. I could no longer get out of the house, because if I walked, it would take me like 2 weeks just to recover for 10-minute walk.
Wow.
And by then, I stopped working. I stopped taking my daughter to school. I just became depressed, because it was like, and because fibroids is not something physical. Like, if I break my arm, everybody can see I've got a plaster on, and people will say, oh, how is your arm? But because they can't see it, as far as everybody's telling me, why do you keep complaining that you're sick when we can't see that you're sick?
I hear you. Absolutely. I hear you.
So, cutting the long story short, I had seen everybody, and they said, right, let's take you to the head of physiotherapist because she should know what to do with you. At this point, I had exhausted all the departments. So I was so hopeful for this appointment. It didn't last more than 10 minutes. She put me on the bed, on massage bed. You know, she did some assessments. After 10 minutes, she said to me, there's nothing we can do for you. That's it. And I tell
Wow.
you, I was devastated. I was heartbroken. I was like, if you can't help me, who else can?
I know. Let's bring Dr. Moji in. Since please introduce yourself, Dr. Moji, and we're not going to be um, throwing darts or arrows, but we're going to want to hear from your perspective as
Okay.
as a medical person. But please introduce yourself first.
Good evening, everyone. My name is Moji Adegbite. I'm a GP. Sorry, I'm joining in late. My apologies. I think was it Sarah that said she had what kind of day did you say you had today?
Busy but productive.
Oh, no, so it's not you then. It's it was hectic. Yeah, you said your day was hectic. Yeah,
I think that was
but
Abby.
Oh yeah, that was me.
oh, Abby, yeah, I had a hectic day too. But yeah, it's good to be here. I think obviously from the other side of the consulting table, it's you always have to, and it's difficult because you see different people, different approaches, but you always. And I think it's difficult sometimes if you're not really feeling what the other person is feeling to sort of be able to actually understand what they're saying, which is why I think many people don't get the help they need quickly enough. So if a woman comes in and says, I'm in pain, usually they may not get listened to because people like Sarah was saying, someone looks at you and says, well, you don't look like you're in pain, you look like you're coping okay. And that is why it takes months and years and years and years for people to have their problems addressed. So I think it's something women have to approach with not aggression, but to be,
I hear you.
to be
Firmness.
assertive and firm
Mm.
in what you're saying. And because the thing is, if you approach it with aggression, it's usually not productive. But I tell you, if you go into your consultation and you're prepared, you will be listened to. Um, and it's, well, I've looked into it. This is really what I would like to happen.
Yeah,
That is the
absolutely.
approach.
Okay,
Now,
thank you. Okay, carry on.
before I go, I want to now, if a woman is going in for the first time, obviously for that first appointment, there will be basic things that need to be done. So expect that, at your first appointment, there will be basic things that need to be done, maybe blood tests or ultrasound or whatever. But subsequently, if nothing is coming out of that, you're not getting anywhere. You need to assert yourself.
Okay, thank you. And be persistent, someone's put.
Yeah.
But so, Dr. Moji, I wanted to ask this question. So, I know you have to push, be persistent, assertive, and all of that. For as a GP, what are the symptoms that you want to look out for once a woman comes and say, okay, I'm going through this, I have this, that you're going to now to start to say, let me start to check or look at this, and this might be the issue? Because sometimes women are left, with no diagnosis, and everyone they just go for, I've heard stories about for long, people didn't know what was wrong with them. Sarah started with, she didn't even know what was going on with her. She just had this bad pain in a private area. So at what point as a GP do you start to say, okay, let me start to check this? Okay, maybe this might be fibroids, or maybe this might be this. What symptoms
So,
do you look out for? Basically,
yeah,
is what I'm asking.
so symptom wise, I mean, every woman will present differently. For some people, it's pain, severe pain during their periods, for example, if they have something like fibroids or endometriosis. Sometimes it's even pain before their period. So they're not even having a period, but they're complaining they're in pain. They're having like period type pains.
Mm-hmm.
Sometimes it's, excessive bleeding during a period, prolonged periods, prolonged bleeding. So it could be a myriad of these, and sometimes if a woman, for example, is bleeding, is having pain, but not on her period, for someone who is not discerning enough
Mm-hmm.
as a medical person, you may not, relate that to, feminine problem. But
Right.
it's being open enough to, and if you've done, the initial bits, you've done your blood test, you've done your ultrasound, you can't really find anything. Or say, for example, you find a fibroid, and the woman is telling you, this is, it's, I'm not coping with it. I'm bleeding too heavily. I'm in pain all the time. As a medical person, we have our limits of practice.
Right.
That's part of what you do. When you've gotten to the point where you no longer have answers for the patient in front of you,
Mm-hmm.
it's at that point you say, well, I've done this, this, and this. We've tried this. It's not really working. You're still having symptoms.
Mm.
I'll refer you on to see a specialist to see what they can do. I do know that, there are women who have gone to specialists, and, it's still been a long journey to find out what the problem is. So, it's difficult. And then we also have the patients where they have been told what the problem is, they
Right.
have been offered treatment,
Mm-hmm.
and are a bit reluctant to go on those treatments. So it's a two-way thing.
Exactly.
Yeah.
Mm-hmm. Because sometimes, okay, I'll speak for myself. And I'll let you go, Abby, after me, because I wanted to hear a bit about your story and what journey you would have to go through, especially with your physical and emotional and mental state whilst you're going through fibroids, and also what your experience was with your treatment and with your GP. Because I was offered right at the start hysterectomy, and I
Oh
thought,
wow.
no, why would I just jump to this place? Is there anything you can do to help me? You know a bit of my story, Dr. Moti. And
Yes.
like, I when the bleeding would stop, so I was looking for alternatives. And
Yeah.
honestly, in these days, I don't think, I think I would have had a better outcome if I take responsibility, if I was a bit more doing my own due diligence too, so that every time I go in front of the consultant, I'm like this and this and this and this, and I'm persistent. I'm also being firm with him, because every time I go to him and oh God, he had a bad attitude. And so what is this again today? I'm like, really? I leave that guy every time going crying, saying I must be the only one in the world that has this kind of problem, because it looks like I'm a burden to this guy because he doesn't know what to do with me.
Yeah.
But
Yeah.
now from what you're saying, maybe it's because he's offered me hysterectomy and I'm pushing back and I'm saying, no, I don't want hysterectomy. Is there nothing else that we can do? Is there
Mm.
nowhere else? How else can you help me? So yeah, I do hear you. But Abby, please share, tell us a bit about your own personal fiber journey.
Okay. I think to a certain extent, I would say I was quite blessed with my journey. I encountered, I thought well, I'd had period pains all throughout my teenage years, but I never attributed it to fibroids.
Mm,
Now, my sister. We discovered my sister had fibroids when she was pregnant, so it was kind of like, oh, she got on with it. She had a baby. Now, what made us discover that I had fibroids was, despite the fact I had constant pains, it was the delay in actually getting pregnant. So
mm,
we've been trying, first year, second year, third year. It's kind of like, what's going on? You
mm,
know, you assume it's the pills that makes you, and then after a couple of years, we started
mm,
investigation, and it was then that they discovered I had fibroids, and the first thing they offered was, oh, surgery, and I'm thinking, oh, I really want to conserve my womb. The last thing I want to consider at this point in time is surgery. You know, just leave me as it is. Let's see if we can manage it conservatively. You
Mm-hmm.
know, and Dr. Moji, like you alluded to, you'd be offered something and you're like, no, surgery? No, I don't want to go down that route, because clearly for me, my concern was, you know, if I had surgery, anything could go wrong. My chances of getting pregnant would
Yeah.
be zilch. So that was how that my journey started. And because I'd been trying, so I was quite fortunate. In them days, I was assigned two specialists, one who was a fibroid specialist and one who was a fertility specialist, because I wasn't getting pregnant. So they weren't sure whether it was the fibroid that was the issue or the
Or something else. Yeah.
that's right. So I went through the whole lip of test. And when I got pregnant the first time, I miscarried. This was after like 7 years of trying.
Wow.
You know, it was like, you know, I miscarried.
Wow.
And then at that point in time, then they decided, they did a proper scan, which actually shows that I had all the different facets of
Mm.
fibroids.
Wow.
You know, I had the one that's in the muscle, I had the one
Yeah.
in the on the submucosa, I
Yeah.
had every type of and I had such a flat tummy. And that's another conception that people think, oh, my tummy's so flat. You know, you assume people with fibroids have big tummies, but I was really petite. There was nothing. My tummy was as flat as a frying pan.
I know skinny people, very skinny people who've got flat tummy and they've got lots of fibroids.
Mm.
Yeah, so those are the myths that we need to burst, because you
Mm-hmm.
just assume that, you know, if my tummy's flat, then I'm fine. And so that was how my journey started. And then I went through a whole leap of started with the hysteroscopic resection, and we went through laparoscopy with a number of different
Mm-hmm.
procedures, in and out of surgery, back and forth like a yo-yo.
Mm-hmm.
I was a revolving door in and out of
Mm.
hospital because of the excessive bleeding, the miscarriage, ectopic pregnancy here. So I ended up with three miscarriages, and then in the last, my sixth surgery, no, my sixth surgery was a myomectomy. And that was when I had an open myomectomy, because at that point in time I just couldn't carry a
Mm.
pregnancy. And they just
Mm.
because you've got multiple fibroids, the
Mm-hmm.
best
Mm.
thing is to open you up
And
and take these fibroids out. And I begged my consultant. I said to you, what brought me on this journey. This journey started off with wanting to have children. So the last thing I want you to do, because obviously I had to sign the consent form, that if there was lots of bleeding, then they would have to take the womb out. And
mm,
so I begged my consultant to please retain my womb, whatever happened. And you know, after the surgery, they took out 14 fibroids. They literally
Mm.
cut different parts of my womb and literally patched my womb back into my into my body, just so that they could retain the womb.
wow, wow,
Mm.
wow. Thank you so much for sharing a bit of your journey. And honestly, I'm going to have Abby back on another in another conversation, just so that she can share her story more in detail. And also some why we have this conversation sometimes is honestly is about letting women know that there's hope, bringing hope to women, and also Abby's written a book about her journey, and that's
Mm.
something that I would also like to explore with her in this conversation and share her journey so women can leverage and get to live well, on this journey of fibroids. So, but if you're currently dealing with fibroids or menopause, put a heart in the chat. Let us know. Um, so, well, my next question, because it's almost half an hour, I wanted to make sure that we touch all three things. I wanted to talk a bit more about perimenopause. We know the many, many signs and the different things that different women go through while in menopause. So, Dr. Moji, I wanted to ask you first, if you go first, if that's okay. We're going to talk about perimenopause now. The many signs of perimenopause that women are, I know I've heard somebody had palpitating heart. She never attributed it to perimenopause. She
Mm.
thought she was dying. And she went to her knee and she said, "No, I'm not leaving this place. Something is
No, I
not right."
know.
Until after so
Yeah.
many checks, said, "How old are you again?" And it's like, is that why? You know, and there's so many symptoms, and we shouldn't just say, oh, it's the hot flushes alone, it is the this or that, it's just the feeling of hair or the headache. There's so many things, and you should know you, and you should know what your symptoms are, honestly.
Mm.
And I say to women, have a journal, you know, write your symptoms down so that you can get appropriate help, especially when your prescription, you know, for if you're going to go to HRT route and all of that, or whatever it is that you choose to go through for treatment. The more things you have documented, honestly, the more the better the help that you can get, you know, on this journey. Anyway, whilst I'm waiting for people to put in there if you're currently dealing with fibroids or perimenopause, because perimenopause, fibroids, and mental health issue was issue that I've had. Okay, so Dr. Moji, do you feel like
Someone's,
do you
yeah,
feel like
someone's put in there night sweats, ringing in ears. I think really, if you mention any symptom, I think, you know, the menopause or the perimenopause, you know, it could be a symptom of either of those. It can cause so many symptoms.
that's
Some
what I
people
was just
get
gonna
itchy
say?
skin.
There is
Some women get
many,
itchy
so
skin, you know.
many,
Yeah.
even leg pain,
Yes.
I couldn't believe
Urine
what.
symptoms,
Mm-hmm,
you know.
mm-hmm,
So the common things we know, sweating, low libido, mood swings, you know, brain fog, all of those. But, you know, there's so many things. You mentioned palpitations, you know, the heart racing. But one thing I want to say to women is whatever symptom you have,
mm-hmm.
as you approach the perimenopause, keep an open mind because you don't want to assume whatever it is you have, whatever symptom you're experiencing
Mm-hmm.
is just the menopause
Yeah,
without having it checked
yeah,
fully.
that's right.
So,
That's
yeah,
right.
so you know, a woman of a certain age symptoms, it's menopausal, you know, and that is not entirely true. Please get your symptoms checked. Now, I developed a thyroid problem a couple of years ago,
Okay.
which has now resolved, by the way, but
Mm-hmm.
it would have been easy to say, you know, I'm menopausal, it must be that. But after a few weeks of feeling unwell, I
Mm-hmm.
took myself off to go and have a blood test and found out that my thyroid was overactive. So without doing baseline
Mm-hmm.
and making assumptions, it's easy to miss things.
I hear
We're
you.
women of a certain age, but you know we can still experience other things. So have a baseline blood test. You know, if you have to have an ECG, a heart tracing,
Mm-hmm.
if you have to go off to see another specialist, to say, for example, you know, someone's put ringing in the ears. Before you assume that is menopause, go and see an ear specialist.
Yeah,
Go and see a
definitely,
cardiologist. You
definitely.
know, so do all of that.
Mm-hmm.
Or, for example, if you're having the, you know, sort of straightforward, more night sweats type thing,
Mm-hmm.
you've had your blood test, nothing flagging up, then you can start to think
Good.
about. So I just wanted to, you know, sort of sound that
Yeah.
warning that, you know, it's
Yeah, and thank
important.
you for that. And thank you for that. That's really important because we cannot attribute everything to
Yeah,
um, perimenopause because we're in that age.
yeah,
Everything still needs to be checked out and just to make sure that
exactly.
no underlying issue. Definitely, definitely. And thank you for clearing that. But I also wanted to ask you something before I go to Sarah and Abby. Do you feel that the medical system is currently in the UK equipped to support women in this transition? Honestly.
Um, I think we're getting there. Maybe not totally, but there's been so much information, so much training over the
Mm-hmm.
last 5 years about the menopause that I think if you stopped any doctor anywhere, they should be the basics. They should be able to say, well, yes, because there's so much push. You know, there's so much training for us on menopause now
Wow.
that,
Okay.
you know, really, yeah, and I won't say we're there because even if amongst doctors, you know, we all tend to gravitate. We like certain things that we do. So some people would be more comfortable doing women's things, which is fine. That's okay. So if, say, for example, I mean, where I work, my surgery, my other colleagues would, send women, my way to say, look, if you want to discuss, menopause or HRT, go and see. So we're getting there. We're not there, that's for sure, but it's getting better,
Okay.
definitely.
But
Yeah.
so is there a pathway, is there a clear plan yet on how, once you identify that, okay, this is what this woman is dealing with, what happens? Is there a referral pathway? How does it work?
So there are referral pathways. There are also, so like I said, depending on, what your GP is happy to handle. It starts with your GP. You've done your basic tests, everything's okay, your blood pressure is fine. Then you start to discuss, okay, this is my symptom. Where do we go with this? So depending on what the woman is feeling. So some women may, for example, have only dryness down the road, in which case your GP can easily, very easily manage that.
Right.
Now, where it becomes more complex, where you have women who say have had heart problems, have had breast cancer, those kind of women, we may have to refer to a specialist because, they're more complex. And there's a clear pathway. There's a menopause clinic run by Gynae, but it just means that the woman might be waiting a bit longer. So there are clear pathways to refer people.
All right. Thank you. Thank you very much. If I ask you, Abby, what's your personal experience, and also what helped you cope?
I think personal experience so far, I've had the standard one, and I really want to say thank you to Dr. Moji for actually raising the point about not assuming that every symptom is related to menopause or perimenopause, because sometimes you just assume and you just conclude, oh, it's that time, and it's really about a lot of things. That the night sweats are horrible,
Mm,
and that one is and then the complete sleepless nights. It's just non-stop.
Yeah.
It's just great. It's just that is like kind of out of control, and it's yeah, that's major, and then I think urinary is another
mm,
thing that I've picked up.
Frequent
It's kind of like, right.
urination. Yeah.
And so there's one thing that I've learned though. I've never been one that drinks a lot of water. So I've now learned that I think I really do need to keep hydrating in order
mm,
to, minimize and reduce the risk of, the urinary stuff. But yes, there's a lot of us. You just kind of want to get on with it and try your best to not think too much about it, you know. But it's there. It's
I know.
constant. It's
I
a
know.
constant thing.
mm,
Um,
Absolutely.
yes. The question is, okay, well, I've not gone as far as actually going to my GPs to talk about it. And people, you just assume like, okay, I'm just going to like just
So
manage it, must cope, and just do what I need to do. Like everyone has all this funny advice here and there, but actually, I know that my sister, she was fortunate. I think she actually asked to get menopausal test. Is there actually a test that says that you are in menopause or in perimenopause, or is that just a conclusion of a number of myriads of tests?
that
It's
was it.
you look at two things, because the problem is, especially in the perimenopause, because your hormones at that point are going up and down. You might find that, you do a test today and yes, the numbers are low or high, as the case may be, whatever you're looking at, and you do it in 2 weeks and it's a whole different picture, which is why the focus is more on the symptoms rather than just the blood test.
Right.
So yes, there is a test you can do, but it's many times not really conclusive, except women that are really postmenopausal. Yes, it might be really clear, but sometimes it's not. So we don't really, especially if you're sort of 45 and above. Yeah, it's not. We just go by the symptoms, really.
Yeah.
Right.
Obviously, if you have younger women and you're thinking, right, she's 30, she's 35. Why is she menopausal? Then yes, we would do a
But
test to guide.
yeah. I think
Interesting.
another thing that we also need to touch on, that if you have any underlying issues like fibroids or anything like that, those tend to trigger people into premenopause or menopause earlier than usually. So I think that's also important to remember that as well.
Yeah, if you're on medication
Yeah.
or, definitely I hear you. And I was just minding to myself earlier on because, some of this menopause symptoms, feeling tired and lacking energy, and at one point I was like, there's something wrong with me. My husband said, are you pregnant? I said, that's not a possibility, but I don't understand why,
Miracle baby.
a miracle. But honestly, seriously, because usually I'm the go do, and then I'm feeling tired, sluggish. I'm like, what's the problem? But now I'm taking magnesium. I'm taking all kind of supplements just to help me. Honestly, and it's
Yeah.
been helpful. It's been
Yeah.
helpful.
I guess we forgot brain fog as well, because
Oh
that's a
Mm,
yeah.
yeah,
mm,
yeah,
That has been my story, but I'm managing it. I'm trying. Things are happening. I'm believing.
yeah.
But honestly, to
mm.
be fair, for me, it's improved quite a lot better in well from before, because I started taking a few more supplements that's really helped me. What's that one? Evening Primrose, is that what it's
Okay.
called? I
Mm,
find that thing. I find that thing helpful. Ashwagandha
mm,
didn't help. It gives me headache, but I find
right.
that evening primrose every time that I take it is useful. I'm taking magnesium, and trust me, people, your vitamin D is good.
Yeah.
Yeah.
And
Take the
vitamin
natural
K.
one. Go
Mm,
out in the sun is
Yeah.
very helpful, and then
Yeah.
take the supplement as well if you have to. Definitely,
yeah.
definitely. Thank you. But Sarah, I wanted to come to you. So, women in perimenopause, how can you help? What you as a therapist, what can you do for women during perimenopause? How can you help women?
Oh
And
wow.
if so, how? How can you help women?
There, there is so much we can do. I think the other thing that we haven't touched on is bone density.
Mm.
So as we enter into premenopause and menopause, the density of our bones changes. And basically what that means, if you think about a sponge that you use to wash dishes, when we're young, our bones, those holes in the sponge, they're
Mm,
full. The older we get, those holes get bigger and bigger. And if we're not either eating the right nutrients or doing exercises to support our bone
mm,
density, the
mm,
bigger those holes get, the weaker the muscles and the joints get, which
mm,
then triggers on that kind of achiness. Then that achiness triggers on that chronic pain.
mm,
And that chronic pain then sends a message to the nervous system to say something is wrong. Then we go into what we call that flight and fight,
mm,
where we're constantly on alert. Now, we need that flight and flight, but the problem comes when we can't turn that off. We need to be able to switch it on and off, on and off. So, in terms of what I do to help women, I use several things. One is a nervous system management, being able to do assessments for women just to see, first of all, let's look at the brain. Is your brain actually working the way it should? So the brain, we have a left and a right side. So I'm able to test to see, is your right brain and left brain working? And through like an assessment less than even seconds, I can tell you whether yes or no. And within less than 5 minutes, we can fix
mm,
that. And
mm,
when your brain is able to communicate to your body, that means actually that helps with brain fog, because brain fog happens because the person is not getting enough blood to go to the brain. And that happens because with premenopause and menopause, you get tightness in the
mm,
body. The more tighter you get pain. So in terms of what I do, by using things like soft tissue therapy, meaning that it's not like a massage, because in soft tissue therapy, we never cause pain. We always use other tools and nervous system management to
mm,
make sure that your skin and your body, that you don't have stiffness,
mm,
because where there is stiffness, When we think about how the blood comes into the body, when we're
Mm,
in that flight and fight, it closes the vessels so that they're so small, so the blood takes longer to get through. But when we work on
mm,
that and you get into that relax and digest, you are able to pump more blood through the body, which means it's getting to your brain, reducing the brain fog. But not only that, you're also stronger because every single person, you should be able to lift weight the same weight that you are.
mm.
Literally.
Wow.
Wow.
Yeah.
Yeah.
And I
Yeah.
know that's shocking.
I know. But honestly, thank you so much for that, Sarah. And I'm currently in therapy with Sarah, and I can tell you the difference. So I'm actually now thinking about it. Now that you've said, because I remember that we did that brain test
Yeah.
thing, and you've given me techniques to just help me. So maybe even that was also helping me, because you remember that I said my brain fogginess
Yeah.
is actually improved. The other day I was very impressed with myself, like, oh, I actually remember. But so honestly, I mean, and it could be that, and I have techniques to just help me cope to just things that I'm doing to for wellness. If and it's really important, honestly, to be able to explore all of these different things, because sometimes it's not just about taking medications or
Mhm.
supplements. Or there are other, alternative things. And the other time you told me about breathing differently. Now I can even tell the difference, because it's
Yeah.
technically breathing, but I didn't know that. We just thought I just thought you breathe in and breathe out, and all of that. But the effects different, other things, and you should do it right. You should do it the proper way, and all of that. And all of these little things actually matters, in the
Absolutely.
holistic thing,
Mm.
And so thank you for sharing that. Thank you so much. Um, I'm looking at the time. Let's come to mental health, honestly, and fibroids, perimenopause, and a woman and her mental health. In all of this. So, if you wanted to go first, Abby, what would you say? How would you say, in your own? You've had fibroids. You're going through perimenopause. How has this affected? And I know you're a busy businesswoman. How is that has it been for you, balancing all of this, mental health wise? How have you been coping? What are you doing to thrive?
Mm. It's a combination of stuff. Definitely, I think with the mental health, with the fibroids, I think that had a major impact on my mental health, because I think the fear and the anxiety of when you go out and before the business, I was in corporate, I was project managing, I was going to different meetings across different regions, and you're driving and you're coming out to meetings and you're not sure what's going to happen, because the fibroids would just cause excessive bleeding. So there was anxiety,
Mm,
there was fear, there was worry, there was, I mean, definitely the mental health impact of that was huge. And clearly, obviously, when it was affecting, obviously before I had the kids, there was massive depression, because obviously that was
Mm.
what was affecting my fertility. But of course, after having the children, I haven't been through 7 surgeries. So thinking, that's it, bye bye to fibroids. It's never going to happen to me anymore. Suddenly, in my early 40s, I turned 40, and it was like the whole tap got opened, and it was like, what? My mental health was bad. I mean, on my 40th birthday, I had a birthday party. I was almost going to cancel it, something I'd been planning for like a whole year, because
Mm.
again, I was bleeding excessively. I couldn't even be sure whether I could stand upright.
Wow.
So the fear that, oh, I'm going to pass out. I'll be going out to places, and I remember there was one time I went out to London, and I was coming back, and I literally felt I was going to pass out, because that was how much I was losing so
mm,
much blood. And
mm,
I'm thinking, thankfully I am a Christian, and I'm happy to say, and it's to say that that's what's kept my mental health.
mm,
And I was really praying that day that I would not pass out in Waterloo on my own. I didn't know who
mm.
to call.
Oh,
I'd been
wow.
traveling from Farnborough all the way, and I just kept praying. And I went to the bathroom, and I got from Waterloo to Euston, and I was in the bathroom for like half an hour thinking, what am I going to do? And I'm coming out in sweats, and I'm panicking, and I'm thinking, I'm looking at everybody. It's peak hours. Nobody, I couldn't call to anyone. I literally got on the train to Milton Keynes, which is where I live, and I sat on the floor. And I know that God sent me his prayer, because guess who calls me? My husband calls me on my phone. And then I said to him, I'm really unwell, blah, blah, blah. And he goes to me, I was going to somewhere in London. I got lost. So I've just got on the train to go to London, back to Milton Keynes. And guess what? My husband was on the train with me.
Oh, wow.
Oh,
That was that was an answer to prayer, because literally by the time we got to Milton Keynes, I'd already almost passed
wow.
out. I was
Wow.
completely gone, and they literally had to lift me from the station out of from the train
Train.
out home. So so the mental health, the impact of just not knowing where you're going to, you could have a normal day in the morning, and
Mm-hmm.
Mm.
suddenly it just takes over your day, and that's it. You don't know what's going to happen.
Yeah,
So
yeah.
that fear, and that was a huge, massive, massive one
Mm.
for me.
Oh, thank you. Thank you for sharing that. Thank you for sharing that honestly. And I hear you about anxiety, not knowing, go, especially if you're in the workplace and you have to, I used to say, I used to say to someone that I used to work in a, in a financial company in the city. The cleaner in that building knows not to touch some things that I've hidden in the bathroom, because those where my changing clothes, the pads, the massive excessive sanitary pads are. Because after a meeting, I'm dashing quickly to the bathroom to go and make sure that I'm changed and I'm all of that. So the anxiety, even sometimes in the meeting, you are not fully concentrated, but you're
Yeah.
thinking, oh, this thing. And then you're getting up from your meeting and trying to say, let me step back, let me go towards the wall so that no one sees me, just in case, I've had an accident and all of those kind of things. So yeah, I do hear you loud and clear. Is there anything you wanted to share, and Sarah, before we go to last thoughts, about this? And
Um,
this is something that we should continue to talk about, because um holding each other up is really essential, and it's really important, and calling these things out so that women don't feel isolated, or they feel ashamed to talk about it, because it's not something to be
Mm.
ashamed about. It's something that you can, because if you don't talk, you will not get the help that you need. We need
Mm.
to speak up more. We need to find a trusted friend, find a trusted community. There are people who can hold your hand up, who can help you on this journey. Please, women, speak up. Sarah, I wanted to hear what you had to say about
um,
all of this.
I think another thing that's really important is finding the right therapy,
Mm,
because
mm,
just listening to Abby's story, I'm like, wow, that's a lot. It's a lot for one person to be able to deal with.
mm-hmm.
And all the time, we need a safe place where we can download these experiences that we've gone
Yeah,
through,
yeah.
because we don't want to just carry on just because things are fine
Mm-hmm.
now. It doesn't mean that those scars are gone. Those scars are still there.
Promise.
and
Yeah, yeah.
and having the right therapy,
Mm-hmm.
I know for me that was so helpful. I'm still in therapy, and and I love it. I
Mm,
absolutely love it, that when I get to a place where I'm like, you know what, this is too much, it's overwhelming,
mm,
I book myself into therapy, and that's
yeah.
really helpful for my mental
Mm.
health.
And thank you for sharing that. And that's something that also, as people of color, honestly, we think, oh, why do I want to go and see a therapist? There's nothing wrong with me. Honestly, the effects of trauma, some of the things that we have gone through, we underestimate how they come out, how they turn out. I know I'm a believer, and we pray about some of these things. That some of these things we need to offload it. We need to actually offload
Yeah.
it, and then so that you can actually begin to it changes perspective, it changes things differently, that I can't even begin to describe. So please, therapy is not a bad thing. Let's
Mm.
do it. If you need it, explore and offload, take things
Yeah.
off,
I
because it's
think
healthier.
definitely I like the idea of this therapy, because I know somebody who, this is now going to perimenopause now, or
Hmm.
menopause. She has completely lost confidence in herself because of this brain fog is excessive for her. So it doesn't feel like it's brain fog anymore. It feels like she's just not remembering things.
Mm-hmm.
She's repeating things all the
Mm-hmm.
time. She's just so, and definitely Sarah, I think I'd like to obviously connect with you just so that
Definitely.
I can refer her to you, because it is a big deal
It
and it's really affecting her right
is.
now in a big way.
It is. It is. And thank you for bringing that up. And I really hear you, because honestly, especially if you're a career woman who you know your stuff, you've been doing this job for a while, and all
Yeah.
that happened to me. And all of a sudden, you get into a meeting, you're thinking, um, and if you start to lose confidence, you're thinking,
Mm.
what is wrong with me? I know what I mean. I used to do this job. What's going on? And you start to lose confidence. You can't go to meetings, or you don't even want to speak up, just in case you will go and forget your word mid sentence, because that was happening to me,
Yeah.
honestly. And shout out to where I was. I was working on a NHS contract then, and they had this clinic. Honestly, that was my lifesaver. Every afternoon, I will go to that menopause clinic. It was a menopause clinic. It was online. I was working remotely, and we'll have women come together, we'll have conversation, people share their symptoms, and that's where I started. And we'll have workshop, people come talk to us, and that's where I started learning. And I started learning how to cope, because then what used to happen then was, when I go to my meetings, I put a disclaimer out. By the way, this is my situation, just in case you told me something I can't remember. Apologies. So we put a disclaimer, and that's how I started copying. I'm like, okay, it's not so bad. I can go to work. At least this is my condition, and I'm putting it out there. Please bear with me. If you told me something while we started this meeting and I forgot, and I was asking you for it, So just finding coping mechanism. And the thing is, I know that Dr. Modia said that things are happening, and there's improvement going on. Find, if you're in a workplace, find if there's a clinic, or if there's a workshop, or there's somewhere you can go to have conversation about your situation. It can be perimenopause, it can be fibroids, whatever. Join a community where conversations are being had, and that's where you can also empower yourself. Things like losing your self-confidence, thinking you are rubbish at your job, when it's job that you've done for the last 20 years, and all of that. We can do this. Let's help each other. Let's carry on encouraging each other. I know we're running out of time, but I wanted to quickly. Did you want to say something, Sarah?
Yeah. I think with all these things happening to us, what it does is we lose our identity. And when we lose our identity, that's when we start questioning ourselves. And when you can find a good therapist, what mine did, actually, she said to me, Sarah, you've got two choices. You can either carry on having a pity party, or you can do something with what's happening to you. And that's because I wanted to train to become a therapist, but I was so scared, because it was like, how am I going to help people when I can't even help myself? And she said to me, Sarah, look at all the great coaches. She said, football, great coaches. Yes, they played when they're young, but right now they don't play, but they're able to coach. And it really helped me to reframe what I was going through, and just looking at it like, whoa, what is happening to me? But rather, I took it, I ran with it, and I worked hard. I still work hard to be able to actually take my experience and now being able to help other women.
Yeah. Turn your pain, isn't it, to. I'm just trying to find questions here. If anyone's asked a question that, great question. I have issues with GPs stating hormones are continuously fluctuating. Sorry, I just wanted to see. Be helpful if we could have tests a few times throughout the month, so we can know our levels and work out what's causing symptoms. Someone is saying. Also, someone says vitamin D should be taken with vitamin K3 for better absorption.
Yeah.
Is that right, Dr. Moji?
I'm not aware of.
Yeah, that is true.
Okay.
I'm not aware
Take
of
both
that.
together. Yeah.
Okay. All right. Okay. Oh God. Last words, everyone. Dr. Moji, what would you like to leave with women? What would you like to say?
Well, I just want to say every woman has a unique journey. Don't own your own journey. Do what works for you.
Mhm.
I mean, fibroids, for example, you know, a woman would readily jump at having a hysterectomy and another would not because of her own journey. Like Abby said, she
Mhm.
wanted children. She was not ready for a hysterectomy. So own your journey,
Yeah.
do your
Mhm.
homework,
Mhm.
assert yourself, and be clear about what you want,
Mhm.
you know, when you go to see your medical people.
Okay. Thank you very much. Abby, did you want to leave?
Yes. I think I will also add to the fact that, you need to be equipped with the information. You need to
Yeah.
be fully aware
Mhm.
and be fully informed.
Yeah.
Yeah.
Every time I went, the reason I suppose I had a good experience with my specialist was every time I went there, I always had series of
Mhm.
questions that to the point where the
Yeah.
specialist would be going online because I've got the latest
Have a
research.
look.
I've got the
Mm.
latest this. I know
That was
what's happening
me.
in America. I know
Yeah.
and so it was always kind of like on the edge every time I came there. But it really did help me because
Mhm.
it
Mm.
helped me to say, this is what I want. And
Mhm.
it's about the consult. You are doing this in consultation with your specialist.
Mm-hmm.
Yeah.
They're not just going to be telling you this is what you need to do and then you accept it.
Yeah.
No, you have that conversation. It was a collaborative approach in
Absolutely.
order for
Exactly.
me to be able to retain my womb, because as far as they were concerned, no, this was the quick way, there was a quick solution, but I wasn't going
Ab-
for the quick solution. You had to come on the journey with me,
Yeah.
and thankfully, I achieved
Yeah.
my desired outcome of having my children, and and then of course
uh, uh,
things happened afterwards.
Thank you, and that's amazing because also, like Dr. Woji said, everyone is unique in their journey. Honestly, yeah, you had them, but I've had women who said they haven't had children, but it was a life
Yeah.
and death matter,
Yeah.
and they chose to say, you know what, get rid of the uterus because
Yeah.
I'd rather, and I can have other options. So
Mm.
thank God, you didn't have to have that. But so every woman is unique in
Mm.
there. Just find your own best solution combination of things, but you have to know that there are options there. Find the options that are available because there are very different
Mm.
options for every woman. Just explore it and have conversation, engage, so that you can have the best possible solution for you. Absolutely. Any last word, Sarah, before we go?
I think my last word would be really for anybody that's having anything going on is really to have the courage to
Mm.
go and find out what it is, because you can't fix what you don't acknowledge. And at least whatever it is that you find out, at
Mm.
least you know what
Mm.
it is, because
Mm.
then you can work towards it.
Mm.
So I think, yeah, my last word is really having the courage to go and find out if something is not right. Have the courage to go and find out what it is.
Thank you, and definitely, I speak up. Let's have these conversations. Let's continue to have this conversation. Let's make it ongoing. It's okay to talk about these things. It's all right to reach out to get help. And I just want to thank you, ladies. Thank you so much, for joining me tonight, and for everyone who's tuned in. Thank you so much. Whether you're battling fibroids or perimenopause, or you're carrying the weight of your story not being heard, please speak up. Your story does matter. Let's keep going with this conversation. Let's help one another. Let's support each other, honestly. And thank you. And to everyone listening, you are not alone. Please, your voice matters. Speak, use it. And thank you, ladies. Thank you very much, everyone. I am grateful for
Thank
this conversation.
you.
We will do it
Thank
Thank
again.
you.
you.
Have a
Thank
lovely
you.
evening and good night.
Thank you.
Thank
Thank
you.
you.
Bye,
Bye
everyone.
bye,
Bye.
everyone.
Bye.
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 Bye. Thank you,
Abby,
Bye.
everyone who's joined.
message me. Yeah.
Okay, will do. Will
Yeah.
do.
Yeah,
Thank
All
you.
right.
I'll get the
Please do.
numbers together. Yeah,
Uh,
Yes.
I'll get
Okay.
my guys.
okay.
Yes.
All right.
All right.
Good
Thank you,
night,
ladies. Thank you,
everybody.
everyone.
Bye.
Have a good
Bye
night. God
Bye.
bye.
bless you.
Bye.
And
Bye.
it's
Bye.
been useful and helpful tonight. Thank you, everyone who's joined. God bless. Have a good night.